Hello, Siraja.
Good morning, ma'am.
Now, we're going to study. Subject Gynecology. Unit 11 Preparation for the clients for following investigation.
Laparoscopy.
Laparoscopy is a type of endoscopy procedure. This procedure will allow the doctor to look inside the abdomen using a thin surgical telescope that has a small lens on one end. Indication. 1. Investigation of pelvis pain. 2. Subfertility. 3. To remove an ovarian or tubal cyst. 4. Pelvic inflammatory disease, including terbites. 5. Congenital pelvic abnormality. 6. Unexplained pelvic mass. 7. Ectopic pregnancy. 8. Adrenal torsion. 9. Abnormal pelvic scan. 10. Staging for ovarian malignancy. Contraindications. 1. Mechanical or paralytic bowel obstructions. 2. Generalized peritonitis. 3. Diaphragmatic hernia. 3. Severe cardiorespiratory disease. 4. Massive obesity. 5. Inflammatory bowel disease. 6. Advanced pregnancy. 7. Multiple abdominal incisions. 8. Large abdominal mass. Test procedure. 1. Place the client in supine position in the surgical setting and insert a varus needle into the peritoneal cavity while the client has general or local anesthetic. 2. A trocar and sheath is inserted into the cavity. The trocar is then removed for the insertion of the laparoscopy. 3. CO2 or nitrous oxide insufflates the peritoneum, creating a pneumoperitoneum. 4. The laparoscopy is advanced into the peritoneal cavity through a small periumbilical incision, and the following is visualized: momentum, the surface of the liver, peritoneum, gallbladder, portions of the spleen, diaphragm, a serosal surface of the small bowel and colon, and in females the ovaries, fallopian tube, and uterus. 5. Areas of pathology are noted and biopsies may be obtained. Nursing intervention. Before test. 1. Explain the test procedure and the purpose of the test. 2. Assess the client's knowledge of the test. 3. Instruct client to be in PO for 6 to 8 hours prior to the procedure. 4. The patient should be instructed to avoid taking natural products and medications with known anticoagulants, antiplatelets, thrombolytics, or disease the dose as ordered. The number of days to withhold medications is dependent on the type of anticoagulants. During test, adhere to standard precautions. After test. 1. If the client has had a general anesthetic, follow the standard protocol for care of the post-operative patient. 2. Observe for any other listed complications. 3. Restrict activity for 2-7 days. Inform the client that residual carbon dioxide effects may produce shoulder and abdominal pain for 1-2 days.
Hysterosalpingography, HSG.
Hysterosalpingography, HSG, allows assessment of both the uterine cavity and the fallopian tubes, and it is a beneficial screening test that can be performed with a high degree of accuracy without the need for a general anesthetic. Indications. 1. To study the potency of the fallopian tubes in infertility and post-operative tuboplasty. 2. To assess the feasibility by studying the location and extent of tubal pathology. 3. To study uterine anomalies such as the septate and cornuate uterus. 4. To detect uterine synechia. 5. To detect uterine polyp. 6. To study incompetence of internal OS. Contraindications. 1. Previous history of allergy to iodine, eggs, or shellfish. 2. Infections of the vagina or fallopian tubes. 3. Uterine bleeding. Patient preparation. Before test. 1. Explain the test procedure and the purpose of test. 2. Assess the client that during injection of contrast medium, a burning sensation may felt for a few seconds behind the eyes or in the jaw, teeth, tongue, or lips. 3. Assess for anxiety and provide sedation as ordered. Administer preoperative medication 30 minutes before the procedure. 4. Obtain baseline vital signs and perform neurological assessment. During test, 1. Adhere to standard precautions. 2. Provide for privacy. 3. Assess for allergic reactions to the contrast medium. After test, 1. Assess the client for possible abdominal discomfort or nausea immediately following the study. Nursing considerations. Pregnancy. 1. Radiation and IV contrast should be avoided in pregnant women if possible. 2. Wear the protective lead shielding to protect the fetus if it is determined this test is necessary. Potential complications. 1. Anaphylaxis due to an allergic reaction to iodinated contrast material. 2. Ascending infection, the spread of tubercular infection. 3. Pelvic irritation and pain due to dye, chemical peritonitis. 4. Allergic reaction to the dye. 5. Pelvic endometriosis if done premenstrually or while the woman is bleeding.
Mammography.
Mammography is a radiographic study using a low-dose X-ray technique to examine breast tissue. It is used to screen for breast cancer or assess for a wide variety of breast tissue anomalies. Indication. 1. Detects breast mass, benign or cancerous, cysts, abscesses, fibrocystic disease, intraductal papilloma of the breast, occult cancer, suppurative mastitis, and Paget's disease of the breast. 2. Evaluates the breast when clinical manifestations are present. 3. Screens for women over 40 and for women at risk for breast cancer. 4. Assess pendulous breasts that are difficult to palpate. 5. Provides a method of socializing a mass before a biopsy procedure. 5. Monitor client after breast biopsy and after cancer management, for example, surgery, radiation, chemotherapy. Contraindications. X-rays are usually avoided during pregnancy unless the benefit to the fetus outweighs the potential risk. Nursing intervention. 1. Teach the client BSE, breast self-examination, and provide brochures outlining the procedure and the signs and symptoms to report. Stress the importance of regular mammography, depending on the client's age. 2. Radiation should be avoided in pregnant women if possible. 3. Wear lead shielding to protect the fetus if it is determined this test is necessary. Patient preparation. Before test, 1. Explain the test procedure and the purpose of the test. 2. Assess the client's knowledge of the test. 3. Assess the client that radiation exposure is minimal. 4. Take the consent of the client. 5. Respect the client's privacy and the sensitive nature of the test, especially if the mammography is not routine but being conducted because of an abnormal breast examination. During test, 1. Adhere to standard precautions. 2. Provide reassurance and a calm atmosphere during the procedure. 3. The client is instructed to take a deep breath and hold it or to exhale and not to breathe as the X-ray is taken. After test, 1. Recommended that client have a routine mammography every other year over the age of 40 and annually after age 50. 2. Also, inform the client women with an increased risk of breast cancer should have a mammogram annually after age 40. Thank you to visit my session.